I think we'll move on to our next speaker now, who is Martin Blake. We're back to a Galway man who's currently in Dublin this evening. Martin is the Chief Veterinary Officer in the Department of Agriculture since 2012. He's a UCD Veterinary and Business graduate. He's responsible for the policy and operational matters for the One Health, One Welfare areas within the Department of Agriculture. He's the Irish delegate to the OIE, which is the World Organization for Animal Health, which I suppose could be considered a sister organization of the World Health Organization. He's currently the chair of the European Commission for the Control of Foot and Mouth Disease and a past member of the Veterinary Council of Ireland. Martin's talk this evening is entitled One Health, Agriculture's Role in the Health of the Nation. So over to you, Martin.
Thank you very much, Damien. Evening all. As Damien says, I'm the Chief Veterinary Officer in the Department of Agriculture, where I have responsibility for policy and operational matters relating to animal health, animal welfare, veterinary public health, and food safety in the areas of products of animal origin. I think this is a very important initiative on behalf of the department, given the importance of all livestock production in the country. And this is building on an initiative last year where we had an Animal Health Awareness Day. I want to thank the Minister for taking time out to present and launch this week for us. And I also want to thank Dominic, Maura and Tracy for their excellent presentations. And lest I forget, I want to thank all the organisers, Paul Corkery, Damien Barrett, and particularly Michael Horden, who was the driver that ensured that this got done. And I also want to thank Bernie Doyle, who assisted me with this presentation. So if you'll excuse me, I'm just taking the liberty to change the title a little bit. And I was influenced to do this by the challenge to the nation currently due to COVID-19, and also reflecting back to the foot and mouth disease event in 2001 and the dioxin event in Ireland here in 2008. I would see health as much more than clinical or subclinical disease associated with biological organisms. And as just as sustainability has a much broader meaning and is impacted by a broader range of factors than people might think. It goes beyond environmental. It's about economic and social factors as well. So too I would look on the word health in this context, particularly in the context of the health of a nation. As previous speakers have said, more and more we see the challenges to society through the lens of One Health. That is the health of humans, animals, and environment. And then, from my perspective, this also stretches into the concept of One Welfare, which reflects the interdependencies between human well-being and animal welfare. And if we look at COVID, we see the impact of stress on business owners, including farmers, and animal owners and other businesses. So the animal disease situation impacts on farmers, not just economically, but on their mental health and stress, dealing with stress. So if we reflect back on the old adage of your health is your wealth. So if I move on just into the context of COVID, it has been very well recognized the direct impact of COVID on individuals' health. But now 9 or 10 months into the pandemic, the indirect impacts are becoming much more identifiable and understandable by the society. And some of these indirect events relate to the virus itself on the health services, broader than the actual dealing with delays in diagnosing and treating non-COVID illnesses, closures or restrictions on community health and support services, but also mental health, isolation, both rural and urban, worry, fear and stress. And I suppose furthermore into the context of the socioeconomic impacts, we see examples of reduced hours of work, business closures, remote working, reduced staffing resources, increased workloads, impact on education, the demands on certain support services like the Alone or Women's Aid, reduced access to indoor and outdoor recreational activities, reduced socializing, and reduced family contacts. So this broad challenge is complex and requires trade-offs. And there's a need to balance the impacts of various sources of risk to society. And this where it actually moved from just a medical public health conversation to a government conversation to actually balance these various risks. So just reflecting back then on the well-being of the nation and how it's measured, and our Central Statistics Office actually identifies 8 parameters which they look at in the context of assessing the well-being of the nation. And you'll see there from economy, work, education, housing and natural environment, governance and equality, health, public safety, and time use. And if we look at it, agriculture impacts very directly on 4 of those: the economy, the work, housing and natural environment, and health. And sustainable farming and sustainable agriculture feed positively into the health and the well-being of the nation. So I think the important thing is, yes, agriculture contributes positively, but within agriculture, there are many risks and challenges which can have a negative impact on the health and well-being of the nation. As others alluded to, One Health, I won't dwell on this, but I also introduced the concept of One Welfare. And again, another umbrella similar to Dominic's, this one, One Welfare umbrella. And so there's an element of bringing this welfare superimposing on One Health to actually recognize animal welfare, biodiversity and the environment are connected to human well-being. And this is not new. If we go back to the 4th century BC, where Hippocrates, father of medicine, produced a pamphlet on air, water and place. And a quote from that is, "Our natures are the physician of our diseases." So even back then, it was recognized that actually the environment impacted on human health. So just reflecting a little bit within our own sectors here in Ireland, we have our National Farmed Animal Health Strategy. And this was an initiative to bring coherence to how we can address farmed animal health and address and plan for the challenges. So it's a strategy that's a reference point for us to approach farmed animal health matters. And the actual mission statement was to improve the standards of farmed animal health, contributing to a vibrant, progressive and sustainable farming and agri-industry, and to Irish society in respect of public health, animal welfare, the environment and the economy. But as I said earlier, agriculture is a risky business. And so it has the potential to go wrong as well as be right. And within the strategy, we recognize 4 overarching principles. It's about working in partnerships, being clear about roles and responsibilities, looking at costs and benefits, and always operating from the premise that prevention is better than cure. And within the strategy, we outline 15 enabling systems and infrastructure, lots of which are provided by the state or semi-state bodies, or engagement by public-private partnerships, or in research and in regulation. So these are all enabling systems and infrastructure which actually support agriculture, farmed animal production in Ireland. So maybe just at the moment we'll just look at one aspect of our animal health strategy about disease prevention, control, surveillance, and eradication. And you could say that's very clearly a private good. If animals get disease, farmer loses money. If sectors get disease, and industry actually is not able to loses production. And there are lots of private actors, be it farmers, private supply of veterinary services and other advisory services, as well as a lot of other players along the actual chain of livestock production. But there are also very significant public supports provided to agriculture. And this recognises the contribution of agriculture to the health of the nation in its broadest sense. Sometimes we struggle as to what is the best use of public supports. Do we pitch it? It's best pitched at strategic supports in the areas of research, coordination, management, leadership, advice, providing management frameworks or structures. You can see in the context of the strategies we've outlined here, these are all national strategies to which we actually use to engage with the stakeholders with a view to actually optimizing animal health in Ireland. And just pointing to the latter two, the National Farmed Animal Biosecurity Strategy, which the Minister will launch later this week, and we have an Animal Welfare Strategy, which hopefully will be launched very shortly. So then just looking within that context, it's a complex environment. There are lots of positives and negatives. If we look from the economic perspective, like we need to ensure that the profitability across the sectors. But there are risks and challenges there. Similarly, in relation to social risks and challenges, be it health or ethical issues in relation to animal welfare. Environmental risks and challenges, greenhouse gases, biodiversity. And then we look at where state supports come in. And state, in the context of some of our semi-state organisations or public-private partnerships or the department itself, are engaged in teaching, learning, research, and then supporting the control and eradication of a lot of endemic diseases. Another lens, look at livestock production as food production. And again, various actors have a role to play, from producers to service providers to regulators. And the context, just looking at the impact of our own organisation here at the department in the context of providing regulatory controls, sometimes that may be seen as a sort of burden on industry, but I'd look at it more as a profit line. It's not a cost line. This is done for the greater good, greater common good, and underpins the standards, the qualities of produce produced in Ireland. Another example, just looking, lots of our speakers today have spoke about avian influenza, and it is a real and imminent threat. And we have, as has been outlined, we have a number of positive cases in wildlife at the moment, wild birds at the moment. It's a very contagious and impactful disease, which actually, not alone is it bad for the birds, is a potential public health risk, but also very significant impact on the economy, because trade is immediately interrupted if disease gets into poultry flocks. So exports come under severe stress. So this is a risky business, and this is actually just pictures of some of the engagement that this department has had with the poultry industry over the last year, with significant engagement, information notes and literature provided. So it just reflects again the risky business of agriculture, and this in itself impacts negatively from a mental or stress perspective on those involved in the industry. Reflecting again on two other angles, the unexpected, which was the COVID-19 and how we've engaged with that. And as I think Tracy said, perhaps we could have done better earlier as a society across the world in the early days. And then we're dealing with the long haul, the antimicrobial resistance, which was foreseen by Fleming himself when he actually discovered, not many years after he discovered penicillin. But it's just pointing towards this sort of coordinated effort and actions. And in particular in Ireland, where we have a good partnership with the Department of Health and also our environmental colleagues, in actually have a national plan, which is our second version, is due is due next year. But just to dwell a little bit on the social and environmental aspects of agriculture and the health and wealth of a nation. Just a printout here of one of the publications that was done for the department in the recent past. It's just looking at the challenges and solutions to supporting farm animal welfare in Ireland, and this is the broader well-being context. And I think, as Dominic has said, some of the issues in the context of the interrelationship between humans and animals, straying not just in the context of the well-known and historical understanding of assistance animals, but also the examples he's given in the care homes, but also in the context of the well-being of farmers dealing with their animals. Like when you have healthy animals, you have a healthy and happy farmer. So I mean, we look at one welfare in the context of leisure, companionship, also in the context of something we have here, social farming, where people are brought onto farms to help with their mental well-being, and an occupational help, and also, as I said, the assistance animals. So again, in the context of not just from the biological threat of the infectious disease, but in the context of the social and environmental challenges, they also have positive and negative impacts. So as just to conclude, looking backwards, and we reflect, we can look from the farmyard back to the health and well-being of the nation. We can see it's positive, it can impact positively in relation to the economy and work, sustaining family farms. It's the foundation stone of food security. It contributes to the national economy, both in the context of employment and export earnings. It also contributes to regional development. In the context of the natural environment, the importance of good animal health for environmental health, be it in the context of air and water, importance from a healthy and robust wildlife population, and also sustaining biodiversity. And from a social perspective, it goes back to the family farms, which are common in this part of the world. It sustains rural communities, so I mean, there's a challenge there. I mean, whilst it does contribute positively, there's a constant job of work to manage and mitigate the risks. So, and just I'd leave you with reference to the department's mission statement, which is about serving the government and people of Ireland by leading, developing and regulating the agri-food sector, protecting public health and optimising social and economic and environmental benefits. So I hope I've convinced you that animal health does contribute to the health and wealth of the nation. Thank you.
Thanks very much, Martin. And I think you'll all agree that we're looking at quite a complex environment with quite a lot of competing interests, and DAFM has quite a wide range of responsibilities in contributing to the health and welfare of the population.